So Elizabeth, I'm just, because I had quite a few more formal questions for you, so I'm just going to go through them as I've written them down. Some of them may not be in complete logical order. Okay.
Mm-hmm. Well, I was going to say, rather than ask me how long I've been a pharmacist, I would rather you ask me how long have I owned a community pharmacy.
Sure.
Because this is about community pharmacy, the actual bricks and mortar. So I know you asked Eileen how long she's been a pharmacist. To me, it's in the bricks and mortar. That's the important thing.
The coronavirus outbreak has been declared a pandemic.
In Italy, there's been the biggest daily rise in deaths since the beginning of the outbreak.
COVID-19 is the biggest challenge of our lifetime.
The coronavirus is the biggest threat this country has faced for decades.
Coronavirus.
Coronavirus.
Coronavirus. Oh, coronavirus out.
Coronavirus.
Coronavirus.
Who is Elizabeth Roddick today? Who are you?
All in all, I'm a community pharmacist through and through. I've been a community pharmacist for many, many years. I've owned a community pharmacy for over 40. And that's it. My father opened his pharmacy, it was a chemist shop in those days, in 1937. And after many years, he asked me if I would like to buy him out. So that happened in 1982. And after that, I moved into bigger premises. And then I owned 2 pharmacies for a while. And eventually I've ended up here in Netherley.
COVID-19 has propelled community pharmacy into a new frontline of medical care. During lockdown, pharmacies' doors remained open for all of their patients. They had no PPE, no social distancing, and a limited understanding of the virus. This is the story of the other frontline.
The latest UK case of coronavirus is the first to be contracted within the country rather than abroad.
When did you first hear COVID-19 or coronavirus?
I think it was January.
January, February.
But middle of March time.
It really hit us most in Scotland was in March.
I heard it was coming out of Wuhan in China, but like all viruses we've had in the past, some come to us, some don't, and some... I never expected it to be a pandemic like it has been.
Probably felt to start with that it would be like some of the other ones that happened, like SARS, that would probably just fade out.
Everything that was happening in Italy, that was quite heartrending, all the people that were dying there, so you were thinking it's coming a wee bit closer to us.
The pressure in the week preceding lockdown was I know it's been a word chucked about a lot during this pandemic, but for us, that week really was unprecedented.
The nationwide lockdown finally arrived and almost every door in the UK was told to close. Pharmacies bravely remained open. No one could have expected the events about to unfold.
I suppose when we eventually got to the announcement, was it a Monday night that Mr. Johnson came on the national television and told us that we were going into a lockdown? It probably wasn't unexpected, to be honest.
On the day when lockdown happened, we all went out to work, as each of us were key workers, so we all went out to work, and it was all over the news of what everybody shouldn't be doing, and you hadn't to leave your houses, and you hadn't to drive, and you hadn't to go anywhere, and we all left.
Lockdown, significant effects for society, significant effects for healthcare. I felt that pharmacy was exposed in terms of community pharmacy, because we have a duty to provide vital life-saving medicines to people. We have a duty to be accessible, and pharmacies were trying really quickly to adapt.
With the number of COVID cases on the rise and the guidelines provided proving ever difficult to follow, life for the pharmacists was becoming increasingly frantic. Their daily workload had quadrupled in size, and the pharmacy staff were now working around the clock to help their community. But their service was beginning to go above and beyond their usual role.
What was it? What was the big difference?
The big difference was with the phone calls, I remember, because the surgeries were closed. So they started to phone. Phone and phone and phone.
What would you like?
The volume of calls had become so great that some pharmacies made the unusual decision to deploy one person just to answer the phone.
Phones, the phones.
Obviously in here we just got busier and busier.
Never seen anything like that, to be honest, at all.
People didn't want to come in for the prescriptions. Our deliveries got busier.
The lead up to that was just something I've never witnessed before.
We got more and more surgeries phoning us with prescriptions, more and more prescriptions coming in. So it just was a constant turnover of work.
It was, I think I said at the time, it was Christmas Eve was always our busiest time of the year in pharmacy, and it was like 3 Christmas Eves rolled into one every day.
So what we ended up with in that week was what I was calling Farmageddon.
We were dealing with a shortage of medicines. Instead of toilet rolls, we had the paracetamol shortage in pharmacies. We were eventually packing down from hundreds into 32s in order to meet demand.
Our prescription volume probably doubled for looking at an average month. So say an average March, a pharmacy would do 5,000 prescription items. In that time frame, they done 10,000, but it wasn't across the month. It was just in those 2 weeks.
Prescriptions for the public were being processed at rates never before seen in pharmacy. The stresses, the strains and the pressures of lockdown were affecting everybody, but pharmacies were amongst those suffering the most.
I was so busy in pharmacy, so even I didn't think about shopping or something, so I just come to work, I come back home, shower, eat something and go to bed. That's all I was doing for March, April, May.
It was very stressful because you had customers just coming in, but there was no protection at all, and they were all just queuing, and all their needs were the most important. They all needed their inhalers and their paracetamol and their thermometers, and you just couldn't get supplies.
Well, that was one of the problems as well, running out of medicines.
You had to deal with their frustrations, plus you were feeling rather, unprotected yourself. And in the family group, I think my family felt I was the most vulnerable.
On the news, it was said that you should get your inhaler because COVID was a respiratory disease, you may need it. So anyone who'd had an inhaler, possibly in the last 10 years, suddenly decided they needed an inhaler. So the number of inhaler prescriptions, again, went through the roof. And we had to try and source them.
So we were all in early and we all had to stay late and do it all again the next day. I don't think I've ever really truthfully felt so tired in all my life. I think we came home at nights and just all laid our heads on top of the countertops.
That was absolutely horrendous. So anytime something was mentioned on the news, you knew that there was going to be a shortage, you're going to have a problem.
And people, because of the surgeries were closed, so people started to come to us for an advice. So that was more job for Mrs. Roddick and Eileen, because they couldn't go to the surgery.
People in general maybe don't think of community pharmacy as being in the front line. But to me, COVID-19 has propelled us into the front line as being sometimes the only health professional that was open.
Even with eye problem or something, that was a lot of people with kids, some allergy, something. So sometimes we had a lot of people
But more than 1,000 doctors and nurses around the world are known to have died from COVID-19.
There were pharmacists dying as a result of their work, just as there were doctors and nurses dying. I don't think it was ever given the publicity to the same extent. I know a couple of pharmacists that did get the virus. Thankfully, none of them had any really long-term side effects from it. But I know in certain areas in other parts of the country, there's been people that haven't been so fortunate.
We should have had at least PPE equipment given to us in pharmacies whilst we were dealing with patients. We weren't given that unless we obviously had to source them ourselves. And at that time, prices of them were ridiculous. For getting any sort of 3-ply stuff was really expensive as well. But just having a small load that could at least tide us over at that time as well would have been good. Everybody else seemed to be getting them as well. GPs managed to get them before us, even though they weren't seeing any patients.
I think at the beginning we were definitely left out to dry. because we had no PPE. Patients were coming right up to the counter. My staff were very, very worried about that, and so was I, because if people had a cough or they had any symptoms, they were still coming into the pharmacy, because where could they go? So right at the start, I feel we were absolutely forgotten about.
Pharmacists actually had, I think when the government announced they were going to pay, I can't remember, it 30,000 I think it was, to healthcare workers who had died as a result of COVID through their job. Pharmacy wasn't mentioned, and I think pharmacists, our negotiating society, the Pharmaceutical Society, the General Pharmaceutical Council, actually had to lobby or go to whoever had made this announcement and say, you've forgotten about pharmacy.
I think we were right at the bottom of the queue from government as well to get a hold of some of this stuff as well, which was a bit of a shame.
Concerns over a lack of personal protection.
The lack of protective equipment, or PPE, is putting lives at risk.
Hundreds of thousands of healthcare workers have been infected.
PPE. PPE. PPE.
PPE. Rounds of clapping cannot protect them from this deadly illness.
The fact that the GPs just stopped absolutely everything was quite a surprise.
I kind of felt, as a student pharmacist, like, why are all the doctors, I was really questioning everything, like, why are we open, why are we not really suffering, but why is no one else helping us?
You know, it just meant that you were just getting all these people with the ailments coming in here, and it was just very, very surprising. And I suppose I thought, if we're open, then how can sort of surgery not operate? If we can manage to operate, I don't know. It just seemed that we got it all, but nature of the job.
I'm just a dispenser, you know, so I had to do my job. I couldn't complain, you know, I couldn't say something. I just received a lot of prescription. I have to process, dispense. That was my job, and I couldn't even phone the surgery, tell them something like, you know, I don't understand why.
I mean, a lot of stuff has been dumped into pharmacy, you know, and without the same degree of care and attention that the hospitals and the doctors' surgeries seem to get.
People still get ill. People were still having problems. And I understood why hospitals to a certain extent shut down, but GPs, I do understand, but I don't, because I know they had to protect themselves, but I feel as if they had all the protection on, then they could have done that and still seen people who needed help, because not just, you know, physical ailments, but mental, it affected an awful lot of people. And I think that is probably one of the things that doctors could have helped them with, which they didn't do.
It's not helped by the fact that you never hear anything mentioned, or very rarely hear anything mentioned in the national news about pharmacies and what pharmacies are doing.
Because I still have to work with them. So as I was saying to you before, I don't really want to come out with a sentence or a feeling about it, if that's all right.
I feel the GPs, at times you did question just what their role was through all of this.
If we were talking over a glass of wine, that'd be a different answer, but we're not, so.
I think in general, most pharmacies have good relations with their GP practice partners, but what GPs did, and I understand why they did it, but pharmacy was unable to do the same thing because we have a different role in the healthcare system. They might never do things the way it was done in February, but there needs to be that contact for people, and there needs to be that access for people that people expect, because not everybody's going to engage in an online way or wants a telephone consultation. Not everybody can do that. So there are genuine clinical reasons why people need to be seen.
With dentists and optometrists shut and doctors' surgeries becoming difficult to access and hospital visits near impossible, more and more patients were turning to community pharmacy for help with their illnesses and emergencies. Pharmacy was now the only easily and open-door healthcare service on the front line of COVID-19.
A lot of patients are coming to us now before they'll even go to the doctors. Well, one, because of the fact of accessibility, they know that they're able to access pharmacy services a lot easier now than before. A lot of times some people just thought that, oh, I've got something wrong with me, I'll just go straight to the doctor as well then that way. So a lot of them are coming in to the pharmacies now as opposed to the GPs as well to check for any small ailments and check if there's anything they can get before even they go and see the doctor as well that way. So yeah, it's definitely opened up a lot of people after obviously the whole March and April type scenario after that.
The amount of work we did, it was at an astonishing level, overloaded and from anything I've ever seen before. And it was the same in every pharmacy.
If it's any, it might not be any consolation to any pharmacist, and I do see it. I've been on a number of, national forums with members of the multidisciplinary team, GPs, A&E consultants, etc. And to be fair, almost everyone, from all professions have said, I have to say, Matt, the community pharmacy throughout this has been, has done a sterling job.
I think maybe their opinions changed a wee bit. So they have. I think from here we've always given a good service. I hope so anyway. And our patients would hopefully always say that. But I think if they look back and think about it, they would say, you know what, they were always there for us. And that's kind of what we want.
They have to take more, they have to realise the importance of pharmacy to the patients. And sometimes you feel that isn't being found.
Pharmacy's been a bit overlooked.
Anecdotally, I could tell you, even from some of the frontline shifts I've did, some of the patients are extremely grateful for, for example, the increased deliveries that pharmacies have did over this time. The care that pharmacies provided and the fact that they've always been open. I think it has been noticed by the public, but yeah, I hope in terms of public consciousness and politically that pharmacy is recognised for the years to come for the role that they've played through this, because they deserve it.
I just hope that the community can identify that this new role we are doing is very valid and very important for progression and the future of our healthcare system.
Well, I think all my life I've been really quite upset about the fact that pharmacists have never really been portrayed in any meaningful way in any, for example, take a soap opera. I mean, we've been perhaps in Holborn City for about a nanosecond until the pharmacist had an affair and was written out, or Casualty recently, I think he was selling something like methadone. I mean, come on. What I'm looking for is, can you not see that there's a whole other side of pharmacy? We're here, we're doing a job, and I think we should be recognised for that.
Pharmacies were there. Pharmacies were open. Pharmacies were the only place you could walk into and get medical help face-to-face during this crisis. Yet pharmacy as a profession has received little recognition in the media for their contributions to healthcare during this crisis.
Everything was closed, but we stayed open just so pharmacies can be heard and probably respected more as, like, doctors. Like, some people say, like, pharmacists are like field doctors, but I kind of see it more like we're a specialist in medicine.
In my job in representing community pharmacy over the last 6 months, community pharmacy has made it very easy for me to do that. The manner in which they've stepped up, right from, as I say, the pharmacists that lead the teams in the pharmacies, right down to delivery drivers, right across the whole team.
Well, I think the recognition is starting to show. I mean, our Scottish Government has now suggested that we gave an outstanding contribution during COVID, and I mean, I think those words are really heartening for us out here.
Honestly, just respect what we do. Just acknowledge what we do as well. Like I want to be a pharmacist for a reason. Like, I don't see myself as a field doctor. I see myself as a pharmacist and a specialist in what I do, and I just want people to acknowledge that as well. Like, we matter. pharmacies matter.
I want to raise the profile of community pharmacy up to where it should be.
They absolutely deserve that recognition, and I would just make a plea from to the public, to the politicians that actually look what pharmacy has done, and please support it appropriately, and give it the recognition it deserves. And yeah, I've maybe said that in so many words before, actually, but yeah, I'll just say that again.
It was hard, but it's hard, but no, I think no, it doesn't matter it's coronavirus or something, but we have to stay strong, help each other, and stay together and love each other. I don't know, it's like,
I think we're all in this together, and we all need to get through it and try our best to come up with things or to live our life whatever way normal is, and we're all in it together, I suppose. That's the way it should be looked at.
I want this little bit of history to show just what pharmacists went through, the fact that we really weren't supported at the beginning, and the fact that we all stood up and said, right, we're going to do this. We're going to help our patients get through this. I think that has to be said.
If there is anything we have learned from this pandemic, it's that frontline healthcare goes far beyond just hospitals and GP surgeries. Every day, thousands of people put their lives at risk in order to keep the country running, without receiving little recognition or praise for their actions. This includes community pharmacy. We want the actions of all those in the front line to be recognised, and we want to put out a message of thanks to those whose work has gone unacknowledged. We hope this film gives testimony to pharmacies and the work they have done to help keep the nation safe during such an unforeseen period of time.